result of that on our mental health services. This report's being compiled by the NHS Confederation and warns there's a risk that some people won't be able to get the treatment they need because of pressure on the system caused by the coronavirus. Sean Duggan is Chief Executive of the NHS Confederation's Mental Health Network. He's with us this morning. Morning, Sean.
Good morning, and thanks for having me on.
No problem. Given what we've been talking about during the coronavirus crisis about mental health, does this report's findings come as any kind of surprise, really?
It doesn't really, no. For the people who've been working in mental health for years, it doesn't come as a surprise. Whenever we've had recessions, economic downturns in the past, there's a connection there with mental health issues. It's easy to work out why people have more pressure on their budgets, job security, and all that sort of thing. It does have an effect on your mental health. The other aspect, of course, during the pandemic, we've all felt a more of a degree of anxiety. People have felt a bit lower because of it, and having to change to the behaviour of lockdown. We've not seen this in a generation, so that's fairly normal, and we all need to look after ourselves and each other. But what we're saying in this report is that for people that need help and for people that have a more serious mental health issue, we need to get prepared for it. It's been right to look at the physical aspects of COVID and prepare for the hospitals, but now it's actually a time to have a focus on the mental health issues and the mental health services, and we're calling for government and local organisations together to make sure they do all the work and get prepared for it.
How much pressure have those services been under, certainly in the last few months?
So it's a complicated changing position. So in the last 3 months, we had a period where referrals and admissions into mental health care reduced. And that was for a number of reasons. And it reduced all over healthcare, didn't it? Well, because people were in lockdown and there was a slight fear that you might get the virus and other factors. That's now changed. The referrals are back to mainly pre-COVID levels. And again, this report is saying that the mental health issues because of the economic downturn and other issues will increase. So we need to make sure we get prepared for that.
Well, I was going to say that some of the reasons behind people's struggles with mental health, certainly over the last few months that you just listed there, were things like finances, job uncertainty and stuff like that. Can another cause be the fact that more and more people are just having to stay in? They can't go anywhere, or certainly couldn't go anywhere, couldn't see anyone, and it's such a massive kind of culture shock for so many people.
Yeah, I mean, that's right. We're all wired up to be social and to have our families and love each other, you know, and to a degree that stopped, and it's hard. It's put pressure on families and on individuals. But there are two parts to it. One is that's sort of fairly normal, and you know we are resilient as individuals, and we can cope with a degree of it. But if that keeps continuing, and there are other issues on top of that, like as you just said, you know, job uncertainty, etc., then you know that can get too much, and then we need to be thinking about mental health services. There's a responsibility on employers as well here. To look after the mental health well-being of their staff. We're much better at doing that now, but I think as people come back from furlough or go into new jobs because of the job situation, we do need to look after the mental health well-being of our staff. It's really important, not just the physical side, but the mental health side as well.
Yeah, we've been talking so much here on BBC Radio Stoke over the last few weeks, last few months,
Sure.
about the importance of people speaking out to whoever that may be, whether it be to a family member, a close friend, or even a stranger. Whatever helps, speak to somebody. Just finally, are you concerned that, aside from physical health problems that have come about because of the coronavirus crisis, do you feel it could take people longer to recover mentally?
Yeah. So I don't know whether it's sort of, but what I'll say is I don't know if it will take longer to recover from a mental health issue. But what I will say is that the rise that we've said in the report, and we've given the sort of evidence on this is going to last for a bit longer. And we know this from the previous recession. There was the sort of real demand happened sort of 2 years afterwards, and then it lasts for a little while. because it takes time to recover from the recession. Although they are saying this time it will be deep but short, which is probably a very good thing. So I think overall the mental health issues will last a bit longer because of the pandemic, and there's plenty of evidence on that. But people need to get that don't not come forward. If you feel you're worried about your mental health, go and see your GP. That's the gatekeeper. That's the first port of call, or get online and use the helplines. But do get some help.
Sean, thank you ever so much for talking to us about that very important issue this morning. That's Sean Duggan, the Chief Executive of the NHS Confederation Mental Health Network, talking about a report out today which says the growing number of people who are struggling with their mental health because of the coronavirus crisis is now in turn putting more pressure on our mental health services. So Sean was just talking at the end there about all of the kind of official people, if you will, in official capacity that you can turn to, whether that be a nurse, whether it be a GP, whether it be somebody official who you call, maybe the Samaritans. We've had them on this show over the last month or so. But if you're struggling, the most important bit of advice that we can give you, we've done quite a bit on this show and with John on Breakfast over the last few months. Talk to somebody. Don't keep it all hidden away inside, whether it be someone you know and trust, whether it be a complete stranger. Just call them, have a chat and talk through what's worrying you, and it can take so much weight off your shoulders, believe me, speaking from personal experience there as well. You can always talk to us, always 0800